Patient Josefina Santiago visited Chile, an endemic rural area where the housing conditions were poor.
I was visiting mi abuela, and what happened next I never would have expected. It was the summer of 2002. 2 days after I came home from visiting my grandmother in Chile, I noticed swelling around my eye. Then I went to visit my doctor.
Josefina came to me after her trip to Chile. She had very obvious swelling around her eye, and upon examination, I found that she was suffering from a fever. She also had an enlarged spleen and an irregular heartbeat, but it wasn't until I found out the patient's travel history that I realized that the parasite affecting her was Trypanosomiasis, also known as Chagas disease. The triatomine bug, also known as the kissing bug, thrives under these conditions, such as mud walls and thatched roofs. In order to become infected with Chagas disease, the patient must come in contact with the feces of an infected kissing bug, a blood-sucking insect that feeds off of animals and humans. After the blood meal is taken, the bug defecates on the skin around the wound. The feces contains compounds that induce itching, leading to the human rubbing the feces into the bite wound. Bites commonly happen around the area surrounding the eyes, leading to the characteristic symptom associated with American trypanosomiasis, a shigoma. This is known in this parasitic infection as Ramona's sign and develops 2 to 3 days after initial infection. Once the feces is rubbed into the bite wound, the metacyclic trypanomastogotes penetrate the cells around the site of the bite. Once inside the cells, the metacyclic trypanomastogotes transform into amastogotes, which then multiply by binary fission within the infected tissue cells. These can survive as intracellular amastogotes or transform into extracellular trypanomastogotes. The life cycle is complete when an uninfected kissing bug takes up a blood meal, ingesting the trypanomastogotes. These migrate to the midgut, where they transform into epimastogotes, multiply, and transform into metacyclic trypanomastogotes in the hindgut. Patients infected with the acute phase are typically asymptomatic. The amastogotes commonly affect the muscle cells within the heart, leading to myocarditis. Systemic infection can also involve the lymph nodes, liver, and spleen. Luckily, the patient, Josefina, was treated with nifurtimox before the chronic phase began. If Josefina did not seek attention, chronic Chagas disease could have lasted the rest of her life, typically 20 to 30 years. The symptoms of chronic Chagas disease consist of cardiomyopathy, megaesophagus characterized by dysphagia and regurgitation, and megacolon, leading to constipation and fecal retention.
After spending 3 terrifying days in the emergency room, I was thankful that Dr. Lance found out what was causing my problems and cured me. Now, I've advised my grandmother to move out of her thatched roof home so that this type of disease can be avoided.
Kiss me.